The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanek, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Good day. Glad to have you here. Thanks for taking your time to watch another episode of TMD Demystified. My name is Tony Urbanek. For those of you who this might be your first episode viewing, let me just say that I, with the help of my patients and a lot of hard work, have uncovered would be a better word, because I really didn't discover anything. I uncovered the actual solution, long-term, non-surgical, for TMD, temporomandibular joint disorder, better known in the vernacular as TMJ. Everybody has TMJ. It's a true statement. Everybody has two TMJs, temporomandibular joints. But the vernacular confuses the name of the joint with the name of the problem. That'll probably go on forever. But the point is, yes, I claim and can prove that I uncovered the mechanism of temporomandibular joint problems, which covers a plethora of symptoms, a very disparate list of symptoms that are confused with other diseases constantly. All right, with just that as a comment at the beginning here, the title of this week's episode of TMD Demystified is TMD and My Personal Responsibility. My responsibility. I have previous episodes, and this episode, I believe, is number 219 episodes, which are found on YouTube and the platform Dental Town under TMD Demystified. And in previous episodes, I have spent a little time discussing the responsibility of the patient in their own problem, in getting their own problem solved, the patient's responsibility, and then a separate episode, I believe, on the doctor's responsibility, on actually treating the patient, solving the problem for the patient, how you do it, what you need to know, what you need to discard. This applies to both patients and doctors, what you need to know, what you need to discard. But today I'm going to be talking about my personal responsibility, because that's why I started out today, which is a Tuesday. I always record on Tuesday morning. The date is September the 16th, 2025. I always record on a Tuesday, and today is no different. I am just going to focus on one particular topic, my responsibility. Now, my responsibility is that I uncovered a very inconvenient truth. That is one way of saying it. This can be verbalized in many ways, but an inconvenient truth, I think most of you are familiar with that terminology, that phrase, as it applies to other things, topics in political life. But the real solution, the real mechanism, the provable mechanism for temporomandibular joint disease is an inconvenient truth for parts of the dental and medical establishments. Because, as you well know, and I've had episodes on this, how dentistry and medicine coalesce at the point of TMD, temporomandibular joint disorder. It is a dental disorder because the medical doctors, the medical establishment didn't want anything to do with it because they thought it had something to do with teeth, which it does in a way, but not the original way. Again, the original way was Dr. Costin, because it was first identified and written upon, published by Dr. James Costin, 1934, and he incorrectly said that the problem, which was for the next 3 decades called Costin syndrome, thereafter called TMJ, was due to lack of posterior dental support, no posterior teeth. And that was incorrect. But that is why the dental establishment got their hands on, inappropriately, unknowingly, and frankly, I don't even think they wanted it, but they ended up with the dentists, the dental establishment, the dental schools were given the responsibility of treating Costin syndrome, TMJ, now known properly as TMD, temporomandibular joint disorder, because it is one disorder. It is not multiple disorders like is taught in the dental schools even today. That's another topic that I need to cover very carefully, completely, but certain dental schools have taken it upon themselves to say that it's multiple diseases, and the dental gurus who treat TMD, the TMD gurus, want to make it complicated, which it is not. This is not a complicated disease when you understand what it is, what the mechanism is. But getting back to the topic of today, then, my responsibility, because I uncovered, didn't discover, because it's all in the literature, and I'll take my time to now invite any of my colleagues to confront me, to debate with me, to bring their information to me, and I will be happy to bring it to you if it is scientifically correct, truly. However, no one in 217, I believe, prior episodes on this podcast, or the prior 150 articles that I've written on my blog about TMD Demystified, no one, not a single doctor, has written me, texted me, emailed me, snail mail me information or wanted to disagree with what I have to say about this problem and my exact description of what the mechanism is for creating all these disparate symptoms. Not one of my colleagues, dental colleagues, anybody from any medical school or dental school, they have not wanted to debate me. They have not wanted to confront me. They have not wanted to disagree with me, because they know what I have uncovered is in the scientific literature. I didn't create it. I can show them where to look that proves the point that inflammation within the temporomandibular joint creates directly each and every symptom of TMD. Symptoms being the common symptoms, the accepted symptoms. There are a few other symptoms that can be debated, which I'm investigating right now, but the common symptoms are frequent and or recurring headache, earache, jaw pain, neck pain, tinnitus, ringing in the ears, subjective hearing loss, a feeling of fullness in the ears, dizziness, vertigo, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and various kinds of jaw locking. Those are the accepted, well-accepted symptoms of TMD, which are confused with many different other kinds of oral facial pains, Meniere's disease, migraine headaches, and ear infections constantly by the physicians. Being both a dentist and a physician, I am well aware of how my colleagues operate, how they think. I'm trained in both fields and trained in the sciences. with scientific degrees and 2 years with the NIH doing my own research project on facial growth and development, which was highly successful. The point being, I uncovered, not discovered, the science that shows what creates all of these disparate symptoms, and it's inflammation within the temporomandibular joint. And if you can decrease the inflammation within the temporomandibular joint adequately, each and every one of those symptoms will dissipate, decrease, and disappear. That is proven in many ways by our scientific study done through Middle Tennessee State University, independently done based on 3,000 successfully treated patients out of this one particular practice. Now we have doctors who are licensed to use this technology in 18 separate states and growing. But the point is, again, what is my responsibility now? And that is the point of this, and that won't take long to explain to you. My responsibility is now for the 76 million plus people in the United States of America alone who suffer from these symptoms and are run around in circles by the medical and dental establishments. That is a fact. How do I know that's a fact? Because we see those patients in our practice and in the other practices who have licensed providers providing this device and protocol, better known as the Urbanek Device and Protocol, now in 18 states. We see patients constantly, every day, who are run around in circles about these symptoms that no one can solve, whether or not they're even diagnosed as TMD. Most of them have been diagnosed as other diseases, again, Meniere's disease, migraine headaches, which the science behind migraines admits, the scientists who study migraine admit they have no idea what causes migraine headaches. That is the current state of science on migraine headaches. Migraine headaches are very severe, a lot of pain. We know that. But we see thousands of patients who have been diagnosed on medication inappropriately, ineffectively for migraine headaches, that when you make the inflammation in the temporomandibular joint diminish, go away, quote, magically, their migraines disappear. So that is, now that I have uncovered it, and it is not mainstream because there's so much pushback, some of it intentionally so. Some of it is out of ignorance. Ignorance is the definition of ignorance is without knowledge. It is not a pejorative to say someone is ignorant, although that's how it's used constantly, to tell someone they're ignorant. No, actually, ignorance is, if you learn a little Latin, without knowledge. And my job is to bring knowledge to the masses, both to the professions, to the dental profession, the medical profession, and especially the population who suffers from this disease. 45% of females alone have temporomandibular joint symptoms. 45%. The problem is almost exclusively a female problem, because something that's been in the literature for 70 years has not been read by the dental profession, which is estrogen exacerbates inflammation. Estrogen, the female hormone, exacerbates inflammation. That is why TMD, temporomandibular joint disorder, and a few other disorders like fibromyalgia is a female problem, because estrogen exacerbates inflammation. So fibromyalgia is inflammation of the muscles, and TMD is chronic inflammation of the temporomandibular joint. Please go to prior episodes of TMD Demystified, where I completely cover and describe why, and the mechanism, how inflammation within the temporomandibular joint can create all those symptoms. But right now, currently, September 16th, 2025, the use of a simple device and protocol to decrease inflammation in the joint is not mainstream dentistry, and certainly not mainstream medicine, because the medical doctors, starting back in 1934, did not want anything to do with the temporomandibular joint problems. So it was given to the dentist, and the dentist had a terrible record of trying to solve this problem. And that would entail probably two or three separate episodes describing the terrible methods that the dentists use to try to solve a relatively simple concept of chronic inflammation within the temporomandibular joint. If you are an orthopedic surgeon and faced with a patient who has chronic pain in the knee, and you do your workup and it shows severe damage to the knee structures, and the patient does not want surgery, the orthopedic surgeon is correctly valid in giving the patient a set of crutches and telling the patient, all right, if you don't want surgery, here's a set of crutches. Get on these crutches, and if you stay on the crutches, I promise your knee pain's going to go away. And he'd be correct 100% of the time. Why? Because you take the load off of a joint, and the inflammatory process will reverse, and it won't hurt. Pain will go away. There's a mechanism behind that, which is in the literature. I didn't discover the mechanism. I'm only commenting on the mechanism. So there is a lot of intentional and unintentional pushback by the professions who have bias in their particular field, whether it be a surgical field, a non-surgical field, neurology, orthodontics, who claim that if you move teeth around, you can treat the temporomandibular joint. And the real problem is the dental establishment, the dental schools do not have a good handle on the cell biology of chronic inflammation and the mechanisms of facial growth and development. That comes into play with orthodontists who straighten teeth, but don't consider the effect that they're pulling on the jaw if they're in the middle of straightening teeth, pulling on the jaw, on the lower jaw, on the mandible, will actually damage the joint and create temporomandibular joint symptoms. I saw a case of that yesterday, literally. And actually the patient figured it out themselves. As we went through the consultation, the patient said to me in the middle of the consultation that 20-some years prior to that, she had been put in a head frame where the orthodontist had put traction on the mandible, and she felt pretty sure that that had something to do with why she developed later in life severe damage in temporomandibular joint symptoms to the temporomandibular joint. And she was correct. She was correct. And I told her so. I said, that's pretty bright of you to figure that out all on yourself without any significant knowledge. What I have to teach, what I have to say is not rocket science. It's a little bit of science. It's a little bit of intuition to get into it, to actually ask my patients to tell me about what makes it better, what makes it worse, where all this started. And they gave me the key where to look. I looked there. I found out that it was effective. Then I had to figure out really what was going on, and read a little more of the scientific literature regarding chronic inflammation, cell biology, growth and development, and then abutted that against what the, quote, mainstream dentists do to try to solve temporomandibular joint problems. And it became obvious they were looking in the wrong place, starting out from the point that they were all taught in dental school that this joint is different. It's not a different joint. It operates like any other joint in the body. So if you start from the point of view that it's different to begin with, you'll never figure it out because you're looking in the wrong place and asking the wrong people. If you start off from the point of view that this joint operates like any other joint in the body, it becomes obvious like the example I gave you with the orthopedic surgeon using crutches, if you use a device that unloads the joint adequately, like a set of crutches unloads a knee, decreasing the chronic inflammation and the symptoms diminish, decrease, or go away. So my responsibility, getting back to the point, my responsibility is to disseminate this information as widely, broadly, and rapidly as I can for the benefit of everyone, because it's a win-win situation. It's certainly a benefit for the patients who have gone through, in a lot of cases, not occasional, decades, many, many, many cases, probably half the patients I see have 2 to 3 decades of being run around in circles by the medical and dental establishment trying to solve these problems that are derived directly from one site, chronic inflammation within the temporomandibular joint. So it's an educational process to bring it into the mainstream. And now, because I know it and I know how easy it is to treat these patients, it is my responsibility to do it. Would I shirk my responsibility if I saw a child getting ready to run out into the street and get run over by a car? Would I say, well, that's not my responsibility because it's not my child, or it's not my car, or I have something better to do? No, if I saw that as a possibility, if I saw that going on, it would be my responsibility. And if I shirk my responsibility, you can imagine, hopefully, how you and I both would feel if you didn't take action about making sure that child did not get run over by a car. So when you find something that is so profound, that affects so many millions of lives, that are run around in circles by the medical and dental establishment, and I repeat that now for the 5th time, because that is what we see, and we have so many patients who will confirm that, literally. And they go through all of the TMD guru services, which are not effective, drugs, physical therapy, Botox. I've talked on that multiple times. Botulinum toxin A, that's truly inappropriate, but they have a lot of money to spend on marketing and advertising. Physical therapy, dry needling, all the different types of drugs that are thrown at patients trying to solve these problems. The confusion with, quote, migraine headaches. I'm not saying that a migraine headache is not a possibility. What I am saying that there actually is no solution for migraines, and they can't even truly define what a migraine is. It does overlap constantly with pain created by temporomandibular joint chronic inflammation. So now I have this responsibility because I have uncovered it, not discovered it. I read the literature. I just brought it to attention. And I'll take this opportunity to invite again any of my colleagues, medical or dental, of any persuasion, of any specialty. If you would like to criticize what I have to say, if you would like to debate what I have to say, I'll be happy to bring you on to this podcast, and we can debate it openly, but be sure to bring your science with you. Make sure that you have the documentation and science that whatever your point of view is, that you can prove what you have to say about what I consider nonsense about treating TMD, or about calling it multiple diseases when it is really just one disease, inflammation within the temporomandibular joint, which can be created by damage to the joint, which is created by only 3 considerations, which is chronic bruxism, clenching and grinding, acute trauma, accidents of different varieties to the face and the jaws, and functional malocclusions. Functional malocclusion being defined as not crooked teeth, but the teeth fit together or jaws, teeth and or jaws fit together in such a terrible way that they overload the joint and damage the joint. Each one of those three have a common situation, a common denominator, which is damage to the temporomandibular joint. All three of those things damage the joint. Damage creates inflammation, and if the inflammation doesn't go to healing, it's called chronic inflammation, which creates all the symptoms. It is now my responsibility, and I take it to heart, just as much as I would take the responsibility of keeping a child safe from running in the street. There are 76 million women in the United States of America who have TMD symptoms. Most of them have significant symptoms. A few of them have just early symptoms. It is a progressive disease. It starts early with just click, 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 click. When you're 14, 15 years old, by the time you're in your 30s, you have headaches, quote, migraines, ear pain, jaw pain, which go untreated, all the way to the point where you have locking and you can't even open your mouth. It is a severe problem. 90% of the patients are female. We talked about that because estrogen exacerbates inflammation, 10% males. That is a lot of people, and that is just in the United States of America. So we need a lot of help to treat this disease very easily. It's not hard to treat. The protocol is simple, 24/7 with this device in your mouth for 2 months and nighttime only the rest of your life. It's very simple. What does this do? It unloads the joint like a set of crutches unloads a bad knee. You use it consistently according to the protocol, and the chronic inflammation diminishes, and, quote, magically, the symptoms go away. That is a lot to carry because it's so simple and the problem is so, said loosely, it is a loose comment, pandemic. 76 million women and another 10% males have these symptoms and don't know what to do about it and are run around in circles by our medical and dental establishment who have tremendous amount of bias, I didn't mean to say that, bias, which is a protective bias for what they believe is the right thing to do inappropriately because of lack of knowledge, ignorance without knowledge. That is why I do this podcast. That is why I write a blog, to get the knowledge out there to as many people, both professional and public, as possible, as rapidly as I can, to solve this problem. And don't pay any attention, and I don't pay any attention to the pushback that I get from my colleagues who are protecting their own turf, and especially from what I term, and I stick by it, the TMD gurus who try to make this problem complicated for their own benefit, for their benefit. That's what I call a TMD gurus. They want to make it complicated because if it's complicated, then it must be more valuable. If it's complicated, it must be more valuable. If it's more valuable, they should charge more. I'll say that openly. All right, I think I've said what I had to say. We'll see if that stirs up any controversy, which it should. Somebody, at least one of my colleagues should have the guts to email me, contact me, and said, I'd like to debate you. I would like to bring my proof that what I have to say is the right thing to do, is the effective thing to do, is the solution for TMD. So far, I have had none, not a single doctor in over 14 years. And they've all had the opportunity to do that. And I have many stories about how they have turned away. They have walked away, turned away, not allowed me actually to present the scientific information that I have. Literally, not allowed me to present the information that I have. They don't want to see it. That's amazing to me. As a scientist, as a doctor, That is amazing. I got a big whiff of that, that some, not all, I don't accuse all doctors of this, but some doctors who are very arrogant don't want to look because it's going to prove them wrong. Until next week, where I'll pick another topic to discuss some aspect of TMD, I look forward and appreciate your attendance at these episodes. I am Tony Urbanek, and this is TMD Demystified.